Hi and welcome to the fourth part in this AnatomicAligner tutorial series. In this video, we will be learning about registration. We're going to be using registration in order to line up our accurate dental arches that were made using an intraoral scanner to our less accurate CT scanned teeth that we modeled here. Registration is vital in the surgical planning process, so our goal here is to perfectly register the upper dental arches and the lower dental arches to the patient's upper teeth and their lower teeth. The dental arches being what was scanned with that intraoral scanner, and their upper and lower teeth being what was made here using the patient's CT scan and the segmentation tools. So to begin, let's go under segmentation / 3D objects and let's import those dental arches. Under 3D objects here, we have import a 3D object as one of our options. It'll navigate to our upper and lower dental arches for that patient. Let's first import the lower one. We're going to get the hierarchy tree here asking us to name the 3D object. It's going to be lower dental arch. Everything's okay. It's okay. We see that object imported there. If we turn off the other two, you can see that. And let's import the upper dental arch, open, and upper dental arch. Okay, now that those are imported, we can return to main menu, and now let's go over registration. So within the registration window, we'll see registration and reference frame here. Let's ensure that registration is highlighted. And under that, we'll see our two modes of registration. These are not mutually exclusive tools, and we'll be using both to ensure that our registration is accurate. Transformation lets us move our dental arches within the 3D space using increments, while auto registration uses landmarks to best fit our dental arch to our CT scan teeth. Let's begin by using auto registration to get as close to an accurate registration as possible. Then we can look through our CT scan to make the minute adjustments as necessary using transformation. Let's first register our upper dental arch to our midface. Let's make sure that just those two objects are visible in our 3D objects panel. So let's turn off our mandible and our lower dental arch. Then up here, we'll choose our from as our upper dental arch and to as our midface. We can then press define / apply. So there are 4 algorithms for registration here. The first two use surface geometry, that's curvature, and the iterative minimum distance and curvature. What curvature does is define an arc using the landmarks we place along the teeth, and it tries to best fit the two arches together. Iterative minimum distance and curvature they treat the landmarks as points, and they create a curve using the landmarks. So it tries to best fit the points together and the arch created by the curvature. So let's use that one, the second one for this registration, and let's not worry about any of the algorithms for registration using paired landmarks for now, as that's not relevant for this type of registration. So let's begin by placing our target landmarks, which are landmarks on our midface. We'll notice the objects changed color here. We have our target as light blue, that's our midface, and our source as yellow, that's our upper dental arch. So we have 3 goals here. We should use a minimum of 3 landmarks, although there's no upper limit on how many we can use. We should place our landmarks as far apart as possible. And finally, we should place our landmarks on the most clearly defined features present in both models. So let's get to placing our landmarks. As I mentioned, we're going to start placing our landmarks on our target object. So let's press add, and looking at the objects side by side here, we can determine where we're going to want to place our landmarks, what's clearly defined in both. Looking at this back left molar here, it seems like this peak is pretty well defined in both. If we don't place it exactly where we want to, we can press edit, replace our landmark, and go back to add. We could also delete to delete the highlighted landmark. That looks good. This canine here is well defined. Looks like the gap between the 2 incisors is pretty well defined. This peak here on that premolar And now we'll want to match those landmarks placed on the target object and place them on the source object. Let's go back to that canine. Place it in the middle of the two incisors. Perhaps it's a bit too far back. We're going to want to be as accurate as possible so we don't have to do a lot of transformation. The better we do here, the less work we have to do later. Let's go back to the premolar and that last molar there. And that looks pretty good. So once we have all of our landmarks placed, let's press apply. Okay, we need to get out of add mode. So now let's press apply. So there we just auto-registered our upper dental arch to our midface. Let's now go through the slides to ensure that we were accurate. We will rarely be perfect with our auto-registration, so we need to carefully examine it. To do so, we can head over to Transformation, and under Display Contour option, we can choose Selected Object, making sure that our upper dental arch is selected. Looking through our slides, we'll now see the profile of that upper dental arch. Let's first look at that contour in our sagittal view. We can zoom in, and let's scroll throughout our slices. Should be pretty vigilant about this to make sure that contour aligns with the teeth. This looks pretty good. Let's look in the other direction. This all looks pretty good so far. Yeah, nothing is glaring. Let's confirm that by looking at our coronal view. You can zoom in on that. Scroll through these slices. Let's go to where we start here. And we're looking to see if the profile of that contour matches the teeth in the CT scan. This is all pretty good. So it looks like, yeah, this is pretty perfect. So I will repeat this exact same process for our lower dental arch using the auto registration, and I'll skip ahead to check that one. And if an issue arises with how accurate we were, I'll show you how to use the transformation tools. So now looking over the contours of our lower dental arch on the mandible from the auto registration, we can see that it's pretty far off. Over here we can see that, and in the sagittal view we can see that very clearly as well. And depending on how poor the auto registration was, you'll either want to go through that process again with better landmarks, more carefully placed landmarks, or you can use transformation to make these small adjustments to perfect your registration. It's really tedious to use transformation to resolve an auto registration that was this poorly done. So here I just redo that, but to show you guys how the transformation tools work, I'll quickly cover those. The first thing we'll want to do is define a center of rotation between our two incisors. So under center of rotation here, under transformation, we can select a landmark, we can user define it, and it's going to let us place a landmark right at that point when we press OK. Now this will fix all of our movement or rotation we do to this point. The first three options we have here, first let's make sure our coordinate system is set to world. So the first three options we have here are movement, linear movement across the X, Y, and Z planes. The X is our red, Y is our green, and blue is our Z. We can add increments here either by typing them in manually or by using the slider. We can use go plus to move forward along that axis, or we can use go minus to move backwards along that axis. And we can see how that changes the contour in our views. So if I move forward along our y-axis, it's actually moving the teeth more inward, and we can see how that's reflected in our CT scans. And we also have rotation. I'll add a quick diagram here on screen to explain rotation, but essentially roll is rotation around the x-axis. So if we wanted to roll, we can roll forward, we can roll backwards. Yaw is rotation around the z-axis. If we wanted to move forward, move backward. And pitch is rotation around the y-axis, if we wanted to move forward, if we wanted to move backwards. And so once you have completed that registration, once you have successfully lined those teeth up, that's it for this step. And so in the next video, we'll cover setting up our reference frame.